Just knee pain and just losing mobility and just wasn't able to be as active as I used to be. I used to be cycling and enjoyed hiking and walking, and just couldn't do that for a long amount of time without a lot of pains. It was here in the lower interior portion and in the upper on the outside. So, like medications, over-the-counter medications,
Yeah, what'd you take?
a lot of Aleve.
What's a lot in like a day, roughly, would you say?
4 to 6 pills
Mm-hmm.
a day.
Yeah.
And that concerned me because it started giving irritation in the digestive system. And so I switched over to curcumin and the turmeric, and
Mm-hmm.
that helped. But it still didn't bring it to a, I had so many friends that had installed procedures for knee replacement,
Mm-hmm.
and it just looked very, it is very invasive, at least I thought so. And just a couple of them were not good results. My background's in engineering, and so with it being a lab and there being data and documents that are written and different medical journal write-ups on it, so there was a lot of data about it and there was a lot of information that was good. It didn't seem to be a fly-by-night type of thing or very casual. It was taken very seriously, and that was important to me, that it had data and that it was a serious approach to a medical condition. I had the injection about 10 weeks ago
Okay.
at the end of the year, and this was the first quarter of the year now. And with that, yeah, just able I do a lot of walking now. Not, the weather's just not enough to go out hiking and on biking and all that, but
Sure.
it's just the stability and the lack of pain in that side is much improved, greatly improved.
Are you needing to take any ibuprofen right now or leave?
No.
Okay. So let's say that you're taking a full six pills for the day of a medication like that.
Mm-hmm.
Did it get you close to where your pain relief is right now?
No. Taking the over-the-counter medication uh, uh, took away the nagging type pain and the nagging type of just gnawing pain. So it allowed me to get around. Okay.
Mm-hmm.
But after the procedure, I liked your words, is that it allows me to function and allows me to do things that I enjoy. And I'm looking forward to the warmer weather when I can actually get out and do some of those items because I don't feel that need to hold back.